Welcome to Public Report. I'm your host, Jeanette Richardson, and today our guests are Kristen Grimes, the Senior Project Manager for Wisconsin Asthma Coalition, and also Dr. Asrani Chu, the Professor of Pediatrics and Medicine for the Medical College of Wisconsin. Our issue is health, and our topic is asthma. So glad that both of you joined us.
Thank you.
Just briefly tell us about yourselves.
I am with the Wisconsin Asthma Coalition, which is part of Children's Health Alliance of Wisconsin, and we are Wisconsin's voice for children's health. We also are affiliated with Children's Hospital of Wisconsin, and we do this by raising awareness, bringing people together, impacting public policy, and implementing programs proven to work.
And I'm an allergist at the Medical College of Wisconsin and Children's Hospital, and I take care of kids and adults with asthma.
Tell us a little bit more about the Wisconsin Asthma Coalition.
Yes, so we are a group of individuals across the state working to take control of asthma. We build partnerships to improve asthma, enhance the quality of life, reduce disparities, and prevent asthma-related deaths. And then we also work to implement our Wisconsin Asthma Plan.
How common is asthma?
Asthma is much more common than you would think. More than 500,000 Wisconsinites have asthma, which equals about 1 in 10 adults and 1 in 13 children. So if you think about a classroom, generally there'd be 1 to 3 children with asthma in each classroom. Or on a baseball or basketball team, you'd have 1 to 2 children with asthma. Or on a larger team, such as a football team, you'd have 5 to 7 children with asthma. We also know many professionals with asthma. So, for example, our very own Packer, Eddie Lacy, has asthma. And there are several Olympic athletes that have asthma. Amy Van Dyken and Tom Dolan are both swimmers. And we also have a marathon runner, Paula Radcliffe.
Well, I did not know asthma was that common. How does the coalition work to improve the lives of those with asthma?
We work through the 4 components of care, which are routine asthma visits, medication, education, and environment. And we take on activities that support each one of these 4 components to reduce our disparities and prevent deaths and improve the quality of life. And we've been very successful over the last 10 years. We've reduced asthma hospitalization rates by 25%, emergency department rates by 20%, and over 10 years we've saved Wisconsin more than $7 million.
What is asthma?
Asthma is a condition that involves the lungs and breathing. There's inflammation that can go on in the airways, and then there's also muscles around the airways that can squeeze shut, really causing some of the symptoms related with asthma. Some of the symptoms can be cough, wheezing, chest tightness, or difficulty breathing.
How is it diagnosed?
You want to have the symptoms that I just mentioned, like cough or wheezing. You want to have typical triggers, and some of those triggers can include exercise or activity, cold air, upper respiratory infections can trigger asthma. Allergies and other kind of irritants in the environment can trigger asthma as well. So those typical symptoms. If medications have been tried, either by the doctor prescribing them, if the medications work, and then also more importantly, besides the subjective symptoms and triggers, doing objective lung function testing is important, especially in the kids or adults that are of the age that can actually participate in doing those breathing tests.
Are there some other treatments?
Yeah, treatments involve mainly 2 types. One is kind of reliever medications, really kind of, we call it rescue medications, and that helps to kind of relieve, again, those muscles around the airways that can squeeze shut. And then, and very importantly, for those that have more persistent symptoms, because inflammation and swelling of the airways is so important, the medications really want to focus on taking care of the inflammation and swelling in the lungs. We call those controller medications.
What will an asthma patient need to do to keep the symptoms under control?
I think it's helpful to actually know that you have asthma, first of all. Again, that's important. Having the medications available that the physician or provider prescribes for the patients and the families. Understanding the triggers so that you can try to alleviate or decrease the triggers and exposures you have. And then understanding how to use the medications appropriately to relieve the symptoms that they may be having.
Is it a good idea to have a written action plan?
An action plan is very helpful, and it's been shown in the literature to really be important as part of the overall plan of taking care of asthma. In that asthma plan, written down are things that you can do to, again, first of all, maybe identify and decrease the exposures and triggers, how much medication should be taken if necessary, and then also, of course, important things like phone numbers to contact your physicians and providers in case there's a worsening of the symptoms.
There's certain things that people who have asthma should have with them at all times, and also do they wear bracelets?
That's a great question. I think what's always important is having that rescue or reliever medication with you at all times. Even if you feel like your asthma is well controlled with the plan you have with your physician or provider, I think having that is important because it's always the question of that kind of perfect storm. If there was a trigger that they might have, and maybe it's cold air that in addition to the trigger, you always want to have that rescue inhaler with you. I think it's also important to make sure that you're using that inhaler appropriately. So we talk about using things like a spacer to make sure that that inhaler is appropriately getting to the lungs as opposed to just being swallowed in their throat.
Can those with asthma lead an active lifestyle?
Oh, definitely. We really want patients with asthma to have an active lifestyle. You don't want to be left on the sidelines. If you know, again, your triggers that you have and you're on the medications that are prescribed by your doctors, you can definitely have an active lifestyle and do whatever you want to do.
Do you find that the public maybe underestimates how serious asthma is?
I think that's definitely the case because a lot of times when people have asthma, they may be doing fine for a period of time, and it's not until they have their exposures, again, whether it's an irritant or an allergen or an upper respiratory infection, and then when they have those symptoms, it really can be very serious. So again, I think that they underestimate or they might, decrease their awareness of how serious asthma can be. But again, with appropriate management and taking care of the asthma, using the medications appropriately as prescribed, and trying to avoid the triggers, people can definitely be able to be active and do whatever they want to do.
Some of the symptoms you talked about are symptoms that you may have if you have a cold. How soon should you question if you may have asthma as far as the duration of the symptoms?
That's a great question because a cold upper respiratory infection can involve, again, nasal drainage. That drainage can cause cough. And in particular, patients that have asthma, colds and viruses can trigger it. So many times I actually ask the families or, again, the patient to see if they can distinguish. Sometimes that loose, junky cough that you can get with a cold or virus, may be more of a sign that it may be more of an infection. Usually for asthma patients, the cough is drier. They don't have as much of that drainage. So that can actually help to distinguish between them. But oftentimes, again, since upper respiratory infections can be a big trigger for asthma, it may be hard to determine the difference. So talking to your healthcare provider may be very helpful in trying to distinguish that.
What are some of the triggers in warmer weather?
Actually, again, differences in temperature can make a difference, can be one of the triggers. So from hot to cold or cold to hot. Again, outdoors, especially if there's things like this time of year with pollen season, that could be something that might be a trigger for the individual. And, again, just sometimes that if it's a ozone action day, so in general, if it's a very hot day, a lot of particulate matter in the sky, those are important things for patients and families to be aware of.
What tools are available to help asthma patients live well with their condition?
So as Dr. Chu shared, it's important for asthma patients to take their medications and their controller medications as prescribed. But we also know that the cost of those medications is quite high. So we want to be able to remove as many of those barriers as possible. And many of the pharmaceutical companies offer either prescription assistance programs or coupons that help lower the cost of the medications and sometimes provide them for free. So we have a page on our website that lists all of the asthma medications out, and it lists if there's a prescription assistance program or a coupon, and it gives the information for everyone to see what they would need to do to obtain either the coupon or the assistance program.
What would you suggest in regard to if someone wanted to learn more about asthma and just stay up on all the new things that's coming out to help them with it?
Well, they could start with our website, which is www.chawisconsin.org, or they could go to Children's Hospital of Wisconsin website or Medical College of Wisconsin's website to learn more. We also on our website offer some programs for assessment of environmental triggers. And we do that in the homes, child care centers, and the schools. So, there's tools available for those folks to use. We have some staff that can provide those services as well. There's an asthma control test on our website. Dr. Chu, do you want to talk about that?
The asthma control test is a series of set questions that, depending on the age of the person, there's a set of questions for children, and then there's a set of questions for adults. The children's questionnaire includes not only how the child is actually feeling, but also how the caregiver perceives if they're having any trouble. And there's a score with each question. Typically, the questions involve, in the last 4 weeks, how has your breathing been? Are you having limitations in your activity, or are you waking up at night? Are you needing to use your rescue inhaler? And then when that test is scored, or the questionnaire is scored, a score of 19 or less really tells you that your asthma is not very well controlled. And then you should talk to your healthcare provider about that to really try to assess, again, is this something just acutely is going on, or if it's something more chronic, and they may be able to, again, appropriately change medications or try to identify triggers and things like that to help out.
How important is it, because we live in an age where people are self-diagnosing and going on the internet to find out how to treat? How important is it to get a professional to treat you with asthma instead of you trying to self-treat it?
I think it's a great question, because there's a lot of information, as you mentioned, on the web, and the internet, family members too. I think, though, it's important. I would much rather have someone think that they might have asthma, and because they're having questions about their difficulty breathing or their limitations in exercise, and talk to their healthcare provider to find out if it truly is asthma, as opposed to someone who's gone undiagnosed or not realizing that they have asthma and don't have the right medication to treat it. So I think it's very important to partner with your healthcare provider to really determine whether or not you have asthma.
Kristen, tell us about the Wisconsin Asthma Plan.
Certainly. So the plan was written by the Wisconsin Asthma Coalition, so it's owned across the state by our partners. And it lists goals, objectives, and action steps on each of the 4 components of care that I shared earlier. And it allows our partners to be able to implement activities across the state. So it serves as a blueprint for our partners. And it allows us to make sure that patients have access to their medications and access to care. It helps us to advocate for needed medications, and that we can ensure our partners know what asthma is and what to do in an asthma emergency. We advocate for clean air policies, both indoor and outdoor, and we bring our partners together to work in a team of care rather than everybody working separately, but working as a group, coordinating care across a system.
Well, Dr. Chu, I was wondering, in regards to at school, a gym teacher or a teacher, what are some of the things that they should look out for with their students?
That's a great question, too, because sometimes the parents don't realize that the child might be having trouble when they're in gym class and they're being more active or in a sports or activity. So the coaches and gym teachers can actually look for, again, if the child seems to be coughing more while they're running around, if they're not keeping up perhaps with their other classmates, those are ideas or triggers that might have them discuss more with the parents and the family members.
I know in my case, I had a nephew who had asthma, and I used to be somewhat nervous about him coming to my house because I didn't know what would justify an emergency. Can you just talk a little bit about that?
Sure. Again, as we talked about, having that rescue inhaler available is important. And so if they have the medications available, and if they look like they're having more trouble with their breathing, of course, giving them their medication would be helpful. If it seems as if that medication's not working, and of course, in discussion with the healthcare provider, the number of puffs of the inhaler may be very important. You may need to give more. But if it seems like it's not working, then calling 911 or an ambulance would be very reasonable, because asthma being serious, the attack can happen very quickly. So it's important to recognize those symptoms and, again, get treatment appropriately.
Well, thank you both for being our guests.
Thank you.
And thank you for watching Public Report. I'm your host, Jeanette Richardson, and today our guests were Kristen Grimes, the Senior Project Manager for the Wisconsin Asthma Coalition, and Dr. Asrani Chu, the Professor of Pediatrics and Medicine at the Medical College of Wisconsin. Our issue, health. Topic, asthma. Thank you again for joining us.